Hello, everybody. A very warm welcome to everybody present here. Today, on this auspicious day of the birthday of our Master Samuel Hahnemann, we are launching our Facebook group amongst the masses so as to propagate the homeopathy and make the public aware of the multifaceted benefits of homeopathy. So, this day we are bringing a very interesting session on the different facets of homeopathy. The session will be presided over by Dr. Raksha Thakkar. She is a senior homeopath from Mumbai and she has been practicing for over 2 decades in Mumbai. She is also the coordinator of She and Her Trust for Women Empowerment, the trustee of TJ Educational Society, committee member of Wagle Estate Doctors Association, Thane, and she is also associated with the Meena Manganlal Charitable Trust, which conducts various camps, seminars, and also helps students through sessions on homeopathy honored by elite magazines in Punjabi and also facilitates back flower therapy. So we now welcome Dr. Raksha. She will be presenting a very beautiful case showcasing the benefit of homeopathy. A very warm welcome, Dr. Raksha. Over to you.
Thank you to Dr. Pooja, and it's give me an immense pleasure to be with you and to share the insights on the different facets of the remedy and herewith share the case presentation. I have been acquainted with Dr. Pooja, and she is a gem of a person, I would say, very humble, and she has been practicing since 20 years in Delhi. She is also associated with an NGO, and I am truly appreciating her efforts, the untiring zeal to spread homeopathy, to propagate it among the masses. Okay. So as she's told for me, it goes true for her as well, that she is also a very keen propagator of homeopathy. She runs even her WhatsApp group, and through her WhatsApp group, she has been sharing sessions on nutrition, diet, and she is an associated to an NGO in Delhi. So you can understand the zeal the Dr. Pooja has when it comes to homeopathy. So herewith we begin with our case. I would be sharing the case and followed here with my analysis and evaluation. And then Dr. Pooja would be sharing gist on materia medica as well of the remedy. Okay. So it so happens that day one, a person is not so. There are various circumstances and there is adaptation due to which the person reacts, because each and every person has to survive in the environment, isn't it? So it depends upon the environment. The environment is the person with whom the patient is acquainted with. So it could be at the family level, it could be at the office level, it could be at the job level, isn't it? So we will understand this through a case. So herewith I begin. So this is the case of a 51-year-old female, and she was suffering from neck muscular spasm. And you have to mark this, that it was on the left hand side. Okay, so left side, the muscular spasm, the neck area, basically. So it was affected. And why left side is affected, I will tell you in the subsequent, as the session goes, you will understand that. Okay. And basically, she was even suffering from migraine. So, migraine also left side. Again, you have to underline left sided. Okay. So, now why left sided? I'm asking you all and I'm emphasizing is because whenever it is loved ones, okay, blood related, the left side is the one which is affected. Okay. So as the case got unfolded and she was giving her case history, so migraine left sided, sun aggravation, and she would get that aura, vomiting as well, and left sided hand was, there was tremendous pain, especially when driving. No, she was driving and she has this muscular pain, and it was since 15 days. All these complaints started. Then this female, she is with, and if we got to see the IPR, she stays with her uh, two sons, and son, the elder one is married, and so the daughter-in-law, and the younger son is studying in 8th standard. Okay, so and she has got one daughter who stays in States. Now it so happened that her sister was also staying in States, and she just recently she died. And this lady is very sympathetic, very pessimistic as well. Okay, so whenever the kids would go out, she would get that negative thoughts. अरे कुछ हो जाएगा तो. Okay, and this female, she would always not allow her kids to even go out and play. नहीं, बच्चे को जो है दूसरी जो है बुरी आदत लग जाएगी, तो वो लत लग जाएगा, तो इसके लिए जो है वो हमेशा अपने बच्चों को घर में ही रखना प्रिफर करते थे, क्योंकि उनकी जो सोसाइटी थी ना, तो वहां पे जो है देयर वर मेनी वुंड्स नियर बाय टू दैट सोसाइटी, तो शी वाज अफ्रेड कि व्हाट मेरे बेटे को भी ऐसे कोई आदत लग जाए करके. ठीक है, अब उनकी जो सिस्टर उधर रहती थी, तो उनको लिवर का कंप्लेन हुआ, एंड देन शी डाइड ऑफ liver complaint, and this lady was grieving. Okay, and she used to get dreams also of her sister. So it so happened that just past 2 days she got the dream, and she was in much agony, so she thought of visiting the physician. Okay, then when she came here with, she said, I am very much concerned about the welfare of my kids. I always constantly worry. Okay. So it so happens that even at night she is like sleepless and constant worry चलता है उनके mind में कि my kids should be safe and nothing should go wrong. She being the eldest daughter-in-law, she would take all the responsibilities of the house. And there was bit controversy with the mother-in-law. So the basic thing, if you got to see the crux of this case, it is that the sister whom she was very much attached to, she would share her feelings as well. And for that, she would then feel so bad, and she was literally grieving that my sister is no more. She died of liver complaints. Okay, and by profession, she was a teacher, but then it so happened that after her delivery, she left that job, and then since it was a joint family, she had to stay with 12 sister-in-laws as well. So it so happened there was no support. Okay, so then she did this Mehndi beautician course, and with this, she was like constantly in to the family background was such that they wouldn't support her. जो भी करना है घर पे रह के आप करना. Earlier she would go teacher करते थे, लेकिन then after delivery they said कि no, it's you stay at home and you can do. Okay, so this is the basic thing, and she had that constant weeping tendency, weeping disposition, and when she was giving case, that time also there was tear film in the eyes, but it didn't roll down the cheeks. Okay, so she had this, and she is very sympathetic. और कोई भी मतलब ऐसे किसी को भी तकलीफ में वो देख नहीं सकते हैं, और किधर अन्याय भी होगा तो वो जो है उसके खिलाफ आवाज उठाएंगे. ठीक है, इनजस्टिस कैन नॉट सपोर्ट. So this is the basic crux, the case. No doubt it was a longer one, but this is the gist of it. Okay, and it so happens that her daughter was studying for MCA. Okay, in States, and in States there is this kind of, she said, I am just depicting what she said, and it's the same verbatim, the same transcript which she described. Okay, so it was like lottery system होता है वहां पे. तो मुझे यही फिक्र थी कि मेरी बेटी को एमसीए में एडमिशन मिलेगा कि नहीं. This was her basic concern. So the whole case revolves around grief, and it even revolves around her care for others. Okay. So when she is very much angry and when she is aggressive, then it is like contradiction aggravates. The anger, contradiction aggravates. So when we sum up everything, I analyzed and I could pick up these rubrics, that is grief, silent grief, anger, contradiction from, case full of day and night, fear climbing boys would be harmed. Now, this fear climbing boys would be harmed. How do we understand it in this case? So it is basically that this फीमेल फील्स दैट मेरे बच्चे जो है बाहर जाएंगे तो उनको जो है खराब संगत लगेगी और उस खराब संगत के वजह से मेरे बच्चे जो है वो बिगड़ने नहीं चाहिए. दैट इज द बेसिक thing which is going at the back of the mind of this female. Okay, so that's the reason why I took this rubric. Actually, I wanted to emphasize on this rubric through this case because we have heard it, but a practical implementation along with the replicability holds true in each and every case. Okay, then injustice cannot support. Then pessimistic. Pessimistic is a negative attitude. So I say an example like a glass is filled with water. Okay, half full. Okay, but the optimistic one will say at least half जो है full है, but pessimistic जो है will see that आधा तो खाली है ना. So why you are seeing the negative side? You got to see the positive ones. But these people being so very much caring. See, causticum belongs to the fourth row. They are bound to family, bound to this house. Okay, so they are basically insecure ones, the fourth of the periodic table. Okay, so I took pessimistic rubric and she is very sentimental because of her weeping disposition. She would weep. Okay, so this was the basic case. Causticum 200 single dose was given to the female, followed by Saclac, and she was asked to report me after a week. After a week, she was very fine and she did not require second dose because as it is, causticum is a deep acting remedy. Okay, so she was all fine and she was all praises for homeopathy as well. And she said, it has definitely given me a lot of relief. And then I continued for Saclac placebo just to see that there shouldn't be any relapse, but she was very fine and just one dose and still she is on Saclac. Okay, so and one more just I want to share of a stalwart book. There was a case where a grandmother, she was babysitting the infant, and it so happened that unexpectedly and suddenly that baby died in her arms. And to add on to it, the daughter-in-law even accused her that because of you, the infant died. So that female, she was grieving. And I have marked few points also. The causticum reacts actively out of sense of injustice. They organize boycotts, okay, and leading to the barricade of planting bombs as well to that level because they are in anarchist and revolutionary. And Dr. Pooja would be sharing the gist of anarchist and revolutionary, the differentiation between the two. I have asked her about the same that you just share her insight. So we will tell Dr. Pooja to share her insight on that and she will be emphasizing on these 2 points. Then it is like fatigue, mental strain, loss of sleep day and night, watching. Then causticum is basically a caregiver. Okay, so prolonged exhaustion and they cry frequently, forgetfulness, long-standing grief and anxiety. So there is a rubric specifically in synthesis repertory, mind cares full of day and night, and the shoulder aspect was affected. No, so shoulder is when one carries the burden, the neck and shoulder. So she is carrying the burden, the responsibility of the family or the kids. Okay, and migraine. So who is giving her headache? Migraine, headache. Tasuma, kit 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 kit. The controversy is going on, isn't it? So this was basically this. and nok jhok chalti rehti hai. That is what she told me, sasu ma. That was like in detail, but the gist was covered that this personality requires causticum. So why the nok jhok and all that part was not required as such. As the case unfolded, I could make out that this is a causticum personality and she requires a causticum remedy. So the gist of this case is grieving and case of causticum. Usually in such cases we think of coculus, night watching and all. But coculus is very mild, yielding, gentle, no? But this lady was aggressive and contradiction aggravates. So thank you so much, Dr. Pooja, for inviting me. And it was immense pleasure to share my insights about this case and on such a wonderful platform as I have seen Health Bite with tremendous people sharing their beautiful insights. And thank you so much for inviting on this auspicious day. And I think I have given justice to this case as well. Thank you so much.
Yeah, thank you so much, Dr. Raksha, for such an amazing and enriching session. And I hope the viewers would have enjoyed this thoroughly, such an elaborate and knowledgeable session. So add on to this, I think you majorly covered all the peculiar points of causticum. So if we talk about it regarding to materia medica, so the basic theme you have covered it, like it covers the grief. Grief can be anything, be it the loss of a dead one or something regarding in kind of a long lasting grief. And the other thing that you mentioned is that here the main feeling of causticum is regarding the anxiety for others. And if we talk about anxiety, so anxiety is basically, it's about a person who has to take care of the group. And he feels that there is some kind of a threat from outside to the group. And he wants that the group should be strong enough to avert that threat. So the example, as the case you have mentioned, that here the lady, like it can be a lady and whose husband must have expired long time back, and like she has to take care of the family. So that concern and that anxiety for the children, it's kind of a natural, but that's exaggerated in case of causticum. Like agar beta kahin bahar gaya hai, so she is always on the tenter hooks, like looking kahan pe hai, kab aayega, kahin kuch ho na gaya ho. See, so
Accident.
so she is full of cares and she is also full of worries about others, about the relatives, about the family members. And also she has a strong, prominent fear that something bad might happen to them. Like if they have gone out, so maybe they can have some kind of accident or any quarrels. So she is always on the tenter hooks. And the second thing that you mentioned about being a revolutionary, because causticum, basically the feeling is idealism. So idealism, it is based upon deep empathy for the suffering for others. And also she couldn't tolerate, he or she couldn't tolerate the injustice. Like these kind of causticum patients, what they will do, like they are seeing any kind of wrongdoing by government or any kind of thing on news, on TV. So they will start the campaigns and they will react strongly to these kind of a news or injustice done to the public on a larger scale. So they are kind of a revolutionaries. Whereas anarchist, he's kind of a different person. He doesn't feel anything like he doesn't believe in any government or anything. So anarchism is basically he doesn't think anyone superior to him. Whereas revolutionary, he is like he's bound by the government, but he feels injustice is not right on the part of a government. So you have beautifully covered all the aspects, all the major aspects of causticum, and I'm sure we everybody like in the audience must have enjoyed such an enriching session. And thank you so much. And we are looking forward to have more such amazing sessions from you. And my greetings to everybody on this auspicious day. May homeopathy prevails for years and decades and centuries to come. Thank you so much.